parents and patients, hey, look, it's summertime, and so I'm going through it, and maybe some of you are going through it. Your kids are getting ready to college. I've got 2 now that are going to be going in college, and there's a lot of anxiety. So look, being in the military, one thing that we do is we always change locations. We call it a PCS, permanent change of station. So when you change your environment, that is uprooting, changing environment, you're moving. There's a lot of stress involved with that. And so if you're not getting good sleep, a little Western medication, a little sleep medication could help. And so what I recommend is talk with your physician in your area and get to know what you like, what your body does well with which medication. For college age women, what I recommend is we don't use anything that causes memory loss. Ambien, I don't think is a good option for my college age women. I would want them to be on something that they can wake up and they can remember and they can still function. And so I would not use Ambien or Zolpidem for college age women just because they're going to a dorm and they need to be able to do well. But this is a good time to figure out what medication will optimize you, whether or not you're going to college or if you're a parent. You don't really want to be experimenting with a brand new sleep medication the night before some big event. For college age kids, a test. For the professionals, you have a big presentation and you don't know what sleep med is good for you. You try something horrible like Benadryl, or alcohol is bad because you won't get good sleep. So keep that in mind. It's better. I like to give my patients some lifestyle medications is what I call this, to figure out you don't need it all the time, but you want to kind of experiment and say that particular sleep medication gets me 8 hours. I don't get grogginess. I don't wake up and buy too many things on Amazon. And that's perfect. So keep that in mind. I think it's always a good deal to understand when you're under anxiety. I'll see you at the next video.